Colic in babies, causes, signs and symptoms, and management. What is colic? Colic is a common condition in infants, typically defined as episodes of excessive crying in an otherwise healthy baby. It usually begins within the first few weeks of life and often resolves by 3 to 4 months of age. Causes of colic. The exact cause of colic is not known, but several theories exist. Immature digestive system. Inability to properly digest food may lead to gas and abdominal discomfort. Gas or digestive issues. Swallowing air while feeding or crying can lead to gas buildup. Food sensitivities or allergies. Sensitivity to cow's milk or certain foods in a breastfeeding mother's diet. Overstimulation. Newborns can become overwhelmed by their environment. Imbalance of gut bacteria. Disruption in healthy intestinal flora may contribute. Parental anxiety or smoking. Parental stress and exposure to cigarette smoke have been linked to colic. Signs and symptoms of colic. Colic is typically defined by the rule of threes. Crying for more than 3 hours a day, on more than 3 days a week, for more than 3 weeks. Other symptoms include high-pitched, intense crying that may sound like screaming. Crying often occurs in the late afternoon or evening. The baby may clench fists, arch the back, and pull the legs up to the belly. A red or flushed face while crying. The baby is difficult to soothe during episodes. Management of colic. There is no specific cure, but several strategies can help manage colic. 1. Feeding techniques. Ensure proper burping during and after feeds. Use slow-flow nipples on bottles to reduce air swallowing. If breastfeeding, monitor maternal diet. For example, reducing caffeine, dairy, spicy foods. 2. Soothing methods. Swaddling the baby. Gentle rocking or using a baby swing. White noise. For example, fan, vacuum, white noise machine. Warm baths or gentle tummy massage. Pacifiers for sucking comfort. 3. Medical options. Simethicone drops. Sometimes used to relieve gas, limited evidence. Probiotics, for example, Lactobacillus reuteri, may help some breastfed babies. If cow's milk protein allergy is suspected, switching to a hypoallergenic formula may be tried, under medical advice. 4. Parental support. Colic can be stressful for parents. Support and reassurance are important. Taking breaks and asking for help can prevent caregiver burnout. Never shake a baby in frustration. Seek help if overwhelmed. When to see a doctor. Always consult a healthcare provider if the baby has fever, vomiting, diarrhea, or poor weight gain. Crying sounds different or is associated with signs of illness. You suspect food intolerance or reflux. Prognosis. Colic is self-limiting and usually resolves by 3 to 4 months of age. It does not cause long-term harm, but support and appropriate management can make this phase easier for both baby and parents.